Okay, finally, how does the map of medicine support the quick process, the quality, innovation, productivity and prevention? Well, in terms of quality, first of all, there's over 350 pathways that are now available. Each of those pathways, on average, has been built over about 800 hours worth of work done between GPs, consultants, nurses, allied health professionals. There's an immense amount of time and effort that's been put in to get that, to get to that point where there is an international pathway. You can use that to then start to localise it, start to say, well, actually, we do things slightly differently here. So it's quality. Not only that, it's being developed inside the NHS. It actually first came out of the Royal Free in discussions between consultants at the Royal Free and local GPs, and between them and Mike Steen and the team, they started to develop. But it's come out of the NHS amongst clinicians who've driven it. And finally, a really important point here that Mike said earlier, that this isn't about mandating a way of doing things. It's not cookbook medicine, but rather it's to enable the supporting of the discussion that takes place between clinicians, between commissioners and providers, to start to say how to improve the quality of care that we deliver. What about innovation? Well, clearly what it's doing is using IT to bring the knowledge to the masses. And when I talk about the masses, I'm not just talking about the doctors in the room. Doctors, nurses, allied health professionals, patients and the public. It is the masses, it is for everybody. It is the only solution that's available where that pathway can be seen by everybody, well, both inside the NHS and outside it. It does allow localisation, which is really important, because if there are things that you're doing differently here, let's hear about them, let's put them down in a pathway, let's make it available for everybody else to use. You take the point about the drug misuse service, clearly there are things that you're doing that go beyond the map. Let's get into that discussion, let's put it down on a pathway so that everybody can access it. And when I'm talking about everybody, I'm not just talking about the GP in surgery, or the consultant or the clinical assistant in the drug misuse service. I'm also talking about the walk-in centres where these patients turn up. I'm talking about the A&E departments. I'm talking about the district nurse clinic where the patient seems to be going off and the nurse notes that they seem to have a drug misuse problem, and starting to wonder what we can do. And in that pathway there'll be information that says this is how we manage the patient, but there may well be also contact details of who to ring if you want to refer a patient into the service. Again, the sort of information that actually we find quite hard to propagate. It is linked directly to the smart card, so you don't need to start putting passwords and things in. As soon as you put your smart card in, you're able to access your local version of the map. And of course, finally, it means that patients who are looking at that pathway can start to experience what quality is. One of the most amazing things I found was when a patient looked at their map of medicine, looked at the care they've received, and came back to me and said, Dr. Hannan, I've received what the map says, I'm getting evidence-based medicine. For the first time, patients are starting to experience what that quality feels like. What about productivity? Well, instead of us kind of procrastinating over what we might do or not do and not sure what to do, the map helps to direct us, helps to focus our energies and the resources that we've got so that we increase the productivity and we're able to do more with the limited resources that we have. And it is about providing the right information to the right people at the right time and in the right place. It enables commissioners and providers to start that discussion, and most importantly, it also helps trainees who first start, or the non-experts amongst us who aren't quite sure what to do, to have some idea of what the right thing is. It doesn't prevent the experts who know beyond the map, and in fact we need the experts to go beyond the map and say, actually we want you to go off piste if you like, and do something different, but if you are going to do something different, make sure that you've written in the notes clearly why you're going off piste, so that clinicians, managers and patients can see that you're doing what you're doing. And then finally, what about prevention? Well, clearly by removing some of that uncertainty and improving the quality of care, we are preventing wastage of very, very small, meagre resources that we've got. We want to try and ensure that if you're not quite sure what you're doing, you're thinking about risk factors, you're thinking about things a little bit beyond what you already know, and start to say, are there other areas that we might be able to consider that we could change? For instance, in depression, it says consider occupation. Under occupation, it says think about if this person is a soldier, or a firefighter or whatever, and start to think about, because it might well be that that person has other resources that they can access because of their job that you may not have thought about if you're just thinking about depression and the 10 causes or whatever it might be. And finally, it can also help to prevent poor referrals into the service, but also for the primary care clinicians, poor discharges, because we can start to think about in terms of a map, what is a good referral and what sorts of factors to put in, and also when a patient's being discharged to sort of say, these are the things that we've done that are included within the map, these are things that we need to think about. Thank you very much.